Good evening, dear viewers, and good evening, Abdullah.
Good evening, Dr. Fatemah, and good evening to our dear audience. Welcome to a new episode of your weekly program, Medical Talk, the program that brings you trusted medical knowledge to help you and your families live healthier lives.
Communication is a very important part of our daily life. Therefore, speech and language therapy plays a major role in helping individuals that have challenges expressing themselves and connecting with others.
Speech and swallowing difficulties can affect both children and adults, impacting learning, confidence, even nutrition, and overall quality of life.
So to help us better understand this important specialty, we are pleased to welcome Fatemah Alshatti, speech, language, and swallowing therapist.
So, dear viewers, stay with us. I'm Abdullah Al-Ajli.
And I'm Dr. Fatemah Alshatti, and you are watching Medical Talk.
Welcome, dear viewers, to another interview in Medical Talk. Today we have with us Fatemah Alshatti, speech, language, and swallowing therapist. Thank you so much for being with us today,
Thank you for having me.
Thank you, Fatemah, for being here.
Thank you for having me.
So, Fatemah, let's start with speech and language therapy. And who can benefit from it, really?
Honestly, from speech and language therapy, all ages can benefit, depending on your need, depending on what the difficulties someone is facing. But as a major, we facilitate therapy for anywhere from newborns until end of life, so all ages. We work with language difficulties, we work with speech difficulties, we work with cognitive difficulties. We also work with swallowing problems, feeding problems as well.
Is it majorly with the young kids, or is it always adults? When treating speech therapy, is it essential to start with them at a young age, or is it fine if you do it later in life?
I think we divide the difficulties into developmental or later in life, like acute. So if the children or the child is born with difficulties from early years, and we detect it like 1 year old, 2 years old, then we start at that age. However, sometimes we have people who have no difficulties and they have some sort of an acute incident or an accident or a stroke, and then our services become necessary. So I would always say whenever there's a problem, we should be addressing it immediately, not giving it more time.
Fatemah, can you please explain to our viewers how can parents recognize any signs of speech delay?
So we have the milestones that we usually consider when we have a child. They should be making some cooing sounds and babbling before the 1 year of age. We expect them to start saying mama and baba by 1 year. We expect them to start pointing. A lot of people don't recognize that pointing, and we call them like non-real words are actually words. So
Yes.
the child can say nana for milk, or they can say atta for a specific person at their household. We still consider that as a functional communication.
Yes.
Sometimes they use specific gestures. So by 1 year, 1 year and a half, we should at least have that in the child's repertoire. The child by then should be able to follow simple instruction like high five, say bye-bye, give me fly kiss, come here. If we notice any delays, usually the first thing we recommend is just to get the child's ear checked, because a lot of time it's just the middle ear fluid, and what happens when the child has middle ear fluid, it blocks their ability to perceive sound, to understand speech, so it just delays it.
So it hinders their ability to learn, actually,
To
because
learn
they can't
it, yes. So a lot of times it's just the middle ear fluid, so that's why you see a lot of practices, and even in Kuwait, we ask them to get their ears checked before coming to us. And then if we realize that the issue is not with the ear, then we'll help them, navigate further and see how we can better support the child. And we usually recommend we start speech therapy at a really young age, because the beautiful thing about speech therapy is that for younger children, it's play therapy. So we sit on the floor, we play with bubbles, we play with toys, and we focus on increasing their language attainment. And it's mainly because when he's 1 or 2 and they have slight delays, it is easier to work with them than when they're 4 or 5, and then there is a higher language demand, because now he's expected to give narrative and talk about his day and tell us what has happened. So the gap becomes really big.
Okay.
And it's harder for us to cover that gap.
Yes.
So we often recommend the early intervention. Even if you're suspecting anything, I always address the parents and say, we're not pharmaceutical approach, we're not surgical approach, we're play-based therapy. So usually there is no harm in doing it. We're just giving them more opportunity to develop language at a younger age.
So the earlier the better always.
Always the earlier is the better. And I think that same goes to physical therapy and any other rehab.
Definitely,
Yes.
definitely. And then you're improving their play function
Yes.
and play skills if the child also probably has any problems with their playing.
And sometimes what we do is that we help the parents play better with their children.
Oh.
So sometimes the child doesn't even need therapy. He just needs, the parents need some sort of guidance.
Yes.
On how to make the play more functional, or how to include more vocab in their daily routine, like shower time, bedtime, grocery shop time.
Yes.
And then we just follow up with them just to make sure everything is going well. So we ease this anxiety that the mothers have and the fathers have when they feel like their child is delayed.
Yes.
And instead of having to go and access like resources from the internet or other parents, it is better always to come to a specialist that they can support you for your child's specific needs.
And improve their communication.
And improve their communication.
Amazing.
That actually takes me to my next question. What advice would you give parents to support their child's communication at home?
So I always say it doesn't require a lot of time to support child's language. First of all, we all know that under the recent recommendation from the American Association of Pediatricians and all the other pediatric associations is that we have to limit screen time. And the reason we want to limit screen time is not just for behavior or sensory, it's because we want to increase interactions. Us as humans, we learn through interactions. And the television doesn't allow us to have that because it's a one-way screen. The child sits there and receives the information. However, they're not using it well. What we would do is just try to make the daily routine an opportunity for language. So when we're sitting on the table, we start naming and labeling fruits and vegetables. We start asking them to hand us stuff, help us in the kitchen preparation, sometimes tidying the clothes. Often, like shower time is a nice time to, learn about body parts, up and down. Children learn best from other children, so play dates are always encouraged. And we always support children to be playing with other children as well. And music is also a very critical part of language learning. So
Yes.
nursery rhymes and other music is always beneficial for a child at this age.
I noticed always having fun and learning at the same time always helps the child.
Yeah, I mean,
get
we're
the
jealous as
information.
adults. We can't have that at universities, but for children, it's always play-based, yes.
Yeah.
Regarding screen time, do you always recommend screen time at a certain age? Or
So the global guidelines is no screen time before the age of 2, and then we go to 30 minutes until a specific age, and then we can increase. However, we do understand that we're working moms and working parents, and sometimes it's difficult to really
especially
adhere.
nowadays.
So we always say make sure you only use it when you need it, and if you want to use it, make it useful. So.
Yes. Educational.
Music-based. You can sing with a child. You can try and make it more interactive. Oh, what is this on the screen? This is an apple. Show me, where's the giraffe? So we can even utilize screen time sometimes to make it a learning opportunity for them. We recommend using shows that are not very highly sensory. So like not a lot of colors, not a lot of bright colors, nothing very fast pacing.
Okay.
Something that's child-friendly, like, remember Open Sesame, Barney. A lot of people like Miss Rachel. These are very child-friendly TV shows.
Yes.
But always after at least the age of 2 years old.
Recommended after the age of 2, yes.
Well, dear viewers, we still have more questions to Fatemah Alshatti, speech and language and swallowing therapist, but after this break.
Dear viewers, welcome back with Fatemah Alshatti, speech, language, and swallowing disorder therapist. Fatemah, can you please tell us, so this is a little bit, we're going to ask you some different questions about swallowing difficulties, which is part of your job. Can you tell us exactly, do children have swallowing difficulties at a very young age? And what are the causes, and how do you diagnose the problem?
The main 2 categories of children that often have swallowing issues are preemie babies, so children that are born prematurely.
Yes.
And therefore they require more support. And we all know a lot of developmental problems happen if a child is born prematurely. One of them is feeding difficulties and feeding disorder. The other half is children who have a specific diagnosis, whether it's neurological or motor diagnosis. We're speaking about cerebral palsy, we're talking about syndromes, we're talking about cleft palate. Usually secondary to their primary diagnosis, we have feeding problems that require our intervention and our follow-ups.
Yes.
That's as a side effect of being born immaturely. Is that correct?
It could be, and it could be, you know, the baby could be also born full term, but then they are diagnosed with a specific syndrome. Sometimes children do unfortunately have incidents like drowning incidents, which leads to brain hypoxia. So that leads to a lot of disabilities arising from that incident. Children with specific syndromes, so we'll notice secondary to their syndromes, it's hard for them to leave the bottle and go to solids, or it's hard for them to chew, or swallow safety is questionable, so they need to be followed up with the speech therapist.
Ms. Fatemah, let's say a kid has a swallowing difficulties. What approach would you take for the therapy for that kid who has a swallowing difficulty?
Yes, so the first thing, we have to do a very thorough examination, and often this examination includes dietitian and include occupational therapist, because we cannot disregard the fact that at this age their nutrition is very critical and crucial. So when we write the plan, we need to make sure that they're even, you know, able to obtain the nutritional intake that they require. We do include occupational therapists because sometimes secondary to these issues, they have sensory problems, they have motor problems, so they can't actually hold objects or they can't close their mouth properly. And what we do is that after their clinical evaluation, we'd create a plan for them. So we want to find the best, safest way for them right now to eat, and then the long-term safe way for them to eat. So sometimes we even recommend non-oral feeding for these children. So we'd ask the family that we'll put them on some sort of nasogastric tube or PEG tube until we're able to, you know, regain the full swallowing skills for that child.
Do you treat adults with swallowing difficulties, for instance, patients with stroke or brain injuries?
Yes, so swallowing difficulties are even more common in adults because you have stroke patients, you have the traumatic brain injury patients, car accident, and so you have patients with cancer, head and neck cancer. Usually that also affects swallowing.
Definitely,
If you're
yeah.
thinking of the site of the radiation, people who have respiratory issues and require, you know, tracheostomy, so therefore their swallowing mechanism is affected.
Yes.
And people with dementia as well. So just part of their neurological regression. You will see they have
Yes.
swallowing problems, people with Parkinson as well, ALS, so all the neurological diseases. So it's a huge chunk of population we cover for adults, and that's why we're usually known to be working with swallowing for adults. People often don't recognize that we work with kids.
Oh, wow.
Yes.
Well, dear viewers, we still have more questions for Fatemah Alshatti, speech and swallowing disorder therapist, but after this break. Welcome back, dear viewers, to Medical Talk. We are still with Fatemah Alshatti, speech, language, and swallowing therapist.
Thank you.
Fatemah, how does technology help improve the speech and language and swallowing therapy nowadays?
So technology is a critical part of our diagnostic, our therapy planning, and our follow-up. We begin with using instrumental assessments. So we are utilizing things like video fluoroscopy to make sure when we're assessing the swallow function, everything is going well, nothing is entering the airway, and we use it for anyone from babies to older people. Nowadays we have a lot of devices that help us also diagnose voice disorders and swallowing disorders, and also we have a lot of applications that can help us with that. As simple as iPads, where we can put programs that can help people communicate better if they're nonverbal. If you're talking about someone who's lost their ability to have voice or speech because of a neurological issue like ALS, I always reference Steve Hawking's, so the device that he has. We have sometimes small machines that can project sound. So a lot of people with head and neck cancer, as part of their treatment, they remove their sound box, so they can't actually make any sound. So there are actual medical devices that are used to create some sort of artificial voice for them. We have a new technology about preserving sound. So we have something that I'm very keen about. It's called voice banking. And we use that with our patients who are expecting that they will lose their voice. And we always tell them, it would be nice that we could preserve your voice. And then once the disease takes its course and you lose your voice, we can actually create a machine that mimics your old voice. And
so you take like a sample of their voice?
Yes, so there is a specific software that we install, and they have to give specific speech sample. And that way, once their voice is lost, the time they use a machine, it will be their
part of their personality,
part of their voice. And it actually helps a lot. So we've seen a lot with people with ALS and neuromuscular diseases, is that once they lose their sound and they use artificial sound, their children or their grandchildren tend to stay away from them.
Yes.
Because the sound becomes very foreign, and that actually affects their psychological well-being. So now with this technology, the voice is still familiar. As we say, they can use the same phrases they used to use, they can use the same pet names for their children that they used to use. And what happens usually when that patient passes away, this becomes a memorial thing that the family continues to have to remember their loved ones.
It's amazing that even you take the psychological effects into consideration.
Yes, yes. The quality of life is really important in our decision making, and that's what differentiates modern medicine from traditional or old medicine, is that the patient has to have the best quality of life, they have to have the best psychological and well-being in their treatment plan. Yes.
It's all connected.
It's all connected, yes.
Fatemah, one last question. So for speech and for swallowing, when would you advise people to seek professional help?
So I always say, for adults, for an example, these problems do not emerge out of nothing. So if you started noticing that you have swallowing difficulties, or your speech is getting more difficult, if you're forgetting names, if you're forgetting names of people around you, then there is a problem. And it could either be a minor problem that could be addressed, or it could be the beginning of diagnosis. So a lot of time with the neurological diseases like ALS and PSP, and also some forms of Alzheimer, the first symptoms are language symptoms.
Yes.
So people usually tend to disregard it, and they don't address it until it's too late, until the disease has taken its course. So that's why we always promote. It is not a usual thing for you to lose your language skill. It's not usual for you to lose your swallowing skill. If that happens, you should address it earlier. And that's for people who haven't had an accident or a stroke or some sort of an acute thing that led them to lose these skills.
Yes.
So it's always the sooner the better, as we say.
Definitely.
Yes, yes.
Well, Fatemah Alshatti, speech and language and swallowing therapist, thank you so much for being with us today. It was an honor having you on the show.
Thank you for having me. Thank you very much.
We had a great time with you. Thank you, Fatemah, for being here.
Thank you.
Well, dear viewers, this brings us to the end of this interview, but we still have more segments on this program after this break.